IPPV intermittent positive pressure ventilation. IQ intelligence quotient. IR insulin resistance. IRDS infant respiratory distress syndrome. ISA intrinsic sympathomimetic activity. ISDN isosorbide dinitrate. ISH isolated systolic hypertension. ISMN isosorbide mononitrate. IT intrathecal. IDP idiopathic thrombocytopenic purpura. Immune-mediated thrombocytopenic purpura. ITU intensive treatment unit. IUCD intrauterine contraceptive device. IU international units. IUD intrauterine death. Intrauterine device. IUFD intrauterine fetal demise. IUGR intrauterine growth retardation. IUI intrauterine insemination. IUP intrauterine pregnancy. IUS intrauterine system. 4 intravenous. IVC inferior vena cava. 4 DSA intravenous digital subtraction angiography. IVDU intravenous drug user. IVF in vitro fertilization. Intravenous fluids. IVP intravenous pyelogram. IVPB intravenous piggyback. IVU intravenous urogram. IVUS intravascular ultrasound. JCV John Cunningham virus. JEV Japanese encephalitis virus. Juvenile idiopathic arthritis. JMS junior medical student. JODM juvenile onset diabetes mellitus. JRA juvenile rheumatoid arthritis. JVD jugular vein distension. JVP jugular venous pressure. K potassium. Ca ketoacidosis. K cal kilocalorie. KCCT kalencephalon clotting time. Kg kilogram. KIV keep in view. KLS kidney, liver, spleen. KS Kaposi's sarcoma. Cartagener syndrome. KSHV Kaposi's sarcoma associated herpes virus. KUB kidneys, ureters, and bladder, X-ray. KVO keep vein open, with slow infusion. LND labor and delivery. LA lymphadenopathy. Left atrium. Lab laboratory. Lab left anterior bundle branch block. LAD leukocyte adhesion deficiency. Lymphadenopathy. Left axis deviation, ECG. LA left atrial enlargement. LAHB left anterior hemiblock. LAM laminectomy. LAP leukocyte alkaline phosphatase. LAP laparotomy. LAR low anterior resection. Loss lymphadenopathy syndrome. LAT lateral. LB, LB pound, mass. LBBB left bundle branch block. LBO large bowel obstruction. LBP low back pain. LBW low birth weight. LCA left coronary artery. LCIS lobular carcinoma in situ. LCM lymphocytic meningitis. LCMV lymphocytic choriomeningitis virus. LCV leukocytoclastic vasculitis. LCX left circumflex artery. LND labor and delivery. LDH lactate dehydrogenase. LDLC low-density lipoprotein cholesterol. LEC lupus erythematosus cell. LEEP loop electrical excision procedure. LE lower esophageal sphincter. Lupus erythematosus systemicus. LE lupus erythematosus. Lower extremity. leukocytes. LFT liver function test. LGA large for gestational age. LGL Loneganong-Levine syndrome. LGM lymphogranulomatosis maligna. LXIL low-grade squamous intraepithelial lesion. LGV lymphogranuloma venereum. LH luteinizing hormone. LIG ligament. LIH left inguinal hernia. LLE left lower extremity. LET's large loop excision of the transformation zone. LLL left lower lobe. LLQ left lower quadrant. LM left main. LMA left mento anterior, fetal position. LOP left occipito posterior, fetal position. LOA left occipito anterior, fetal position. Lysis of adhesions. LMCA left main coronary artery. LMD local medical doctor. LMP last menstrual period. LN lymph node. LOC loss of consciousness. Level of consciousness. LOF leakage of fluid. LORTA loss of resistance to air. LOS length of stay. LOT lotion. LP lipoprotein. LP lumbar puncture. LPH left posterior hemiblock, heart block. LPL lipoprotein lipase. LSB left sternal border. LSIL low-grade squamous intraepithelial lesion. LR lactated Ringer's solution. LRTI lower respiratory tract infection. LT heat label enterotoxin. LTAC long-term acute care. LTCS low transverse C-section. LUL left upper lobe. LUQ left upper quadrant. LV left ventricle. LVAD left ventricular assist device. LVAD left ventricular and diastolic pressure. LVEF left ventricular ejection fraction. LVF left ventricular failure. LVH left ventricular hypertrophy. LVOT left ventricular outflow tract. LWBS left without being seen. LX of CH laxative of choice. Li lymphocytes. Lights electrolytes. May moves all extremities. MAHA microangiopathic hemolytic anemia. MAL mid-axillary line. MALT mucosa associated lymphoid tissue. MAOI monoamine oxidase inhibitor. M5 macrophage. MAP mean arterial pressure. MC metacarpal bone. Marsamethicillin and aminoglycoside resistant Staphylococcus aureus. Moss Morgani Adams-Stokes syndrome. MAT multifocal atrial tachycardia. Microscopic agglutination test. MCD minimal change disease. MCP metacarpophalangeal joint. MDD major depressive disorder. MDE major depressive episode. MCHC mean cell hemoglobin concentration. MCH mean cell hemoglobin. Mean corpuscular hemoglobin. MCNS microscopy, culture, and sensitivity. MCV mean cell volume. MDS myelodysplastic syndrome. M/E microscopic examination. Men multiple endocrine neoplasia. MESH medical subject headings. MET metabolic equivalent. MET metastasis. Mg magnesium. MGN membranous glomerulonephritis. MgSO4 magnesium sulfate. MGUS monoclonal gammopathy of undetermined significance. MI myocardial infarction. MIC minimum inhibitory concentration. MICA mental illness and chemical abuse. Mentally ill chemical abuser. MICU mobile intensive care unit. MLC mixed lymphocyte culture. MLE midline episiotomy. Myeloid metaplasia. MNM morbidity and mortality. MMPI Minnesota multiphasic personality inventory. MN membranous nephropathy. MOD moderate. Modified. MODY maturity onset diabetes of the young. MO monocytes. MOM milk of magnesia. MPD myeloproliferative disease. MPGN membranoproliferative glomerulonephritis. MPV mean platelet volume. Mr. mitral regurgitation. Modified release. Medical representative. Mental retardation. MRA magnetic resonance angiography. MRCP magnetic resonance cholangiopancreatography. MRG murmurs, rubs, and gallops. MRI magnetic resonance imaging. MRSA methicillin-resistant Staphylococcus aureus. MS mitral stenosis. Multiple sclerosis. MSE mental status examination. MSH melanocyte stimulating hormone. MSK medullary sponge kidney. MSO4 morphine or morphine sulfate. MSU midstream urine sample. MSUD maple syrup urine disease.